Today we're going to discuss anxiety disorders. Anxiety is often used synonymously with worry. So occasional anxiety or worry is an expected part of life. Sometimes you go through events that cause stress, and that doesn't always mean it's a bad thing. A little stress can be very beneficial, and it often acts as a motivator. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. This type of anxiety is very persistent. The symptoms can interfere with daily activities such as job performance, schoolwork, and relationships. Here are the anxiety disorders we're going to cover today: generalized anxiety disorder, panic disorder, phobias, and selective mutism. Generalized anxiety disorder is excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in areas of their life, such as social interactions, school, and work. Here are the symptoms of generalized anxiety disorder: feeling restless, wound up or on edge, being easily fatigued, having difficulty concentrating, being irritable, having muscle tension, difficulty controlling feelings of worry, and having sleep problems. Now, panic disorder is a little different. So people with panic disorder have recurrent, unexpected panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as a feared object or situation. During a panic attack, people may experience heart palpitations, sweating, trembling, sensations of shortness of breath or choking, feelings of impending doom, and feelings of being out of control. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding triggers. Worry about panic attacks and the effort spent trying to avoid these attacks can cause significant problems. As you can imagine, the stress of an impending attack can trigger attacks themselves. Phobias. A phobia is a persistent, excessive, unrealistic fear of an object, person, animal, activity, or situation. Now, the key word you need to understand here is unrealistic fear. Okay? Being afraid of something that is perceived as normal or may actually happen to you would not be considered unrealistic. So this is a type of anxiety disorder. A person with a phobia either tries to avoid the thing that triggers the fear or endures it with great anxiety and distress. And there are 3 major types of phobias. The first type is a specific phobia, often referred to as a simple phobia. With this most common form of phobia, people may fear specific animals such as dogs or cats, people, environments, or situations. These conditions are at least partly genetic or inherited and seem to run in families. The second type is social anxiety disorder, also known as social phobia. People with social anxiety disorder fear social situations where they may be humiliated, embarrassed, or judged by others. The fear may be limited to performance, such as giving a lecture, concert, or business presentation, or it may be more generalized, so that the phobic person avoids many social situations, such as eating in public or using a public restroom. Social phobia seems to run in families also. People who have been shy or solitary as children, or who have a history of unhappy or negative social experiences in childhood, seem more likely to develop this disorder. The last type of phobia is agoraphobia. You've probably heard of this before. Agoraphobia is a fear of being in public places where it would be difficult or embarrassing to make a sudden exit. A person with agoraphobia may avoid going to a movie or concert or traveling on a bus or train. Many people with agoraphobia also have panic symptoms or panic disorder, which involves intense fear plus uncontrollable physical symptoms such as trembling, heart palpitations, and sweating. Childhood phobias occur most commonly between the ages of 5 and 9 and tend to last a short while. Most longer-lasting phobias begin later in life, especially in people in their 20s. Adult phobias tend to last for many years, and they are less likely to go away on their own unless they are treated. Phobias can increase an adult's risk of other types of psychiatric illnesses, especially other anxiety disorders, depression, and substance abuse. Here's an infographic of some common types of phobias from A to Z, so they're in alphabetical order. I'll just read a few examples. So again, we've already mentioned agoraphobia, fear of being in a public place. We also have bathyphobia, fear of deep places, claustrophobia, right, fear of enclosed spaces, and there's a couple interesting ones you may have never heard of before. The symptoms of phobias are pretty consistent with general anxiety disorder. So you have excessive, unreasonable, or unrealistic, persistent feelings of fear and anxiety. Feelings are either irrational or out of proportion. Okay? So you may have no realistic reason to be afraid, or you might be reasonably afraid, but you might take it completely out of proportion. Right? So for example, it is a little reasonable to be afraid of snakes. But if you react very strongly or really dramatically, that would be unreasonable, right? So for example, while anyone may be afraid of an unrestrained, menacing dog, most people do not run away from a calm, quiet animal on a leash. And that's a good example of the unreasonable part, taking out of proportion. Avoidance of the object, activity, or situation that triggers the phobia. Because people who have phobias recognize that their fears are exaggerated, they are often ashamed or embarrassed about their symptoms. To prevent anxiety symptoms or embarrassment, they avoid the triggers for the phobia. Anxiety-related physical symptoms are another symptom. These can include tremors, palpitations, sweating, shortness of breath, dizziness, nausea, or other symptoms that reflect the body's fight or flight response to danger. Symptoms such as these may lead to a diagnosis of panic disorder. The last type of anxiety we'll talk about today is selective mutism. I find this particularly interesting. A somewhat rare disorder associated with anxiety is selective mutism. Selective mutism occurs when people fail to speak in specific social situations, despite having normal language skills. Selective mutism usually occurs before the age of 5 and is often associated with extreme shyness, fear of social embarrassment, compulsive traits, withdrawal, clinging behavior, and temper tantrums. People diagnosed with selective mutism are also diagnosed with other anxiety disorders. So selective mutism is different than regular mutism because these individuals can, in fact, speak. Right? They're not lacking the ability. They just are choosing, or subconsciously or consciously, to not speak. So some of the treatments for phobias include psychotherapy or talk therapy, where you would talk out your issues with a therapist, cognitive behavioral therapy, where the therapist will both work on cognitively changing your view of the phobia while also implementing some behavior changes. Medications, antidepressants, beta blockers. These are medications that control physiological symptoms, so that might control your heart rate or blood pressure. Support groups, where you work with other people with similar phobias, and stress management techniques.